Why don't doctors know about palindromic rheumatism? Imagine trying to catch a fleeting shadow or a whisper that disappears before you can fully grasp it. That's similar to why many doctors find it challenging to recognize palindromic rheumatism. This condition is a rare form of inflammatory arthritis that comes and goes unpredictably, making it tricky to diagnose. Unlike rheumatoid arthritis, which usually causes persistent joint pain and swelling, palindromic rheumatism involves short, episodic attacks that can last just a few hours or days and then completely resolve. Because these attacks are intermittent, patients often appear normal during doctor visits, which can lead to missed or delayed diagnosis. One of the biggest hurdles is that there is no single blood test or imaging scan that can definitively diagnose palindromic rheumatism. Doctors relying heavily on the patient's detailed history and observation of symptoms during attacks. Since these episodes come and go, a patient might have normal blood work or no visible joint swelling when examined, making it hard to confirm the condition. This episodic nature is quite different from rheumatoid arthritis, which tends to be more persistent and has well-established diagnostic criteria. Another reason for limited awareness is that symptoms like joint pain, swelling, and stiffness are common to many types of arthritis. Palindromic rheumatism shares features with rheumatoid arthritis, and many patients with palindromic attacks test positive for rheumatoid factor or anti-citrullonated protein antibodies, which are markers often associated with rheumatoid arthritis. This overlap can cause confusion, leading to misdiagnosis or taking longer for doctors to recognize palindromic rheumatism as a distinct condition. Because attacks are short-lived and resolve completely between episodes, doctors may not see the full picture during a consultation. They might mistake it for other intermittent conditions or overlook it entirely. Additionally, there are no widely accepted diagnostic criteria for palindromic rheumatism, unlike rheumatoid arthritis, which has clear guidelines. This lack of standardization means that recognition of the condition varies among healthcare providers. Palindromic rheumatism is also less common and less studied than rheumatoid arthritis. Many general practitioners and even some rheumatologists may have limited experience with it. Ongoing research is still exploring its causes, how it relates to rheumatoid arthritis, and whether it might be a separate disease or part of a spectrum. Because of this, medical training may not emphasize it enough, leading to gaps in knowledge. From the perspective of rheumatoid arthritis, recognizing palindromic rheumatism is important because it can sometimes be a warning sign or precursor to rheumatoid arthritis. Some patients with palindromic attacks eventually develop persistent joint inflammation characteristic of rheumatoid arthritis, while others do not. Early identification can help in monitoring and managing symptoms more effectively, possibly preventing progression. In summary, doctors may not know much about palindromic rheumatism because it is rare. Its symptoms are episodic and transient. There are no specific tests to confirm it, and it overlaps with other more familiar conditions like rheumatoid arthritis. Improving medical education, encouraging detailed documentation of attacks, and increasing awareness can help clinicians better recognize and treat this condition. If you experience sudden, short episodes of joint pain and swelling, it's always best to consult a healthcare professional who can evaluate your symptoms thoroughly and provide personalized advice.